Dr. Ruth O'Regan has been involved with some of the studies on the breast cancer index test. She explained to us the gap that this test fills for patients and the role that it plays in helping patients and their doctors tailor their treatments.
So the breast cancer index test is a test that uses tissue from a patient's original surgical specimen and biopsy, and it looks at the genes that are driving, or specific genes that the expression of specific genes within a patient's tumor. So it's a combination of 5 genes that are associated with how rapidly cancer cells grow, and 2 other genes named HOXB12 or H, or IL-17BR, or IL, which is known as the H over I index. And what the expression of these genes tells us is, first of all, how likely it is that a patient's tumor will recur after 5 years since diagnosis, but also it helps us to decide whether further endocrine therapy might be of benefit to an individual patient to prevent the cancer recurring. So based on an older study, what we've traditionally done is used 5 years of endocrine therapy. But one of the questions out there is, are there patients that actually need more chronic therapy, or certainly given for 10 years? So there's been a number of trials that have compared 10 years of endocrine therapy with 5 years. And in general, they've shown some benefit overall in extending therapy for 10 years, but it really varies from patient to patient. So the breast cancer index, basically by measuring the expression of these 5 genes associated with how quickly the cells multiply, and the H over I index, actually tells us, firstly, what the likelihood is that a patient's cancer is going to recur beyond 5 years. But secondly, the H over I index component actually tells us whether a patient might benefit from extended hormone therapy. So rather than just telling everybody they need 10 years of treatment, this tells us, the results of this test tells us which patients can actually stop at 5 years. So in other words, you're basically tailoring the duration of therapy to the patient's individual breast cancer.
Since there are many tumor profiling tests available, Dr. O'Regan also explained to us how the breast cancer index test is different from other tumor profiling tests.
There's a number of what we call genomic assays used in treating breast cancer patients. So there's several tests that are used up front to determine what the benefit an individual patient will get from adjuvant chemotherapy. The breast cancer index is a little bit different because the H over I part of it is really associated specifically with estrogen receptor signaling. So it is a test that tells us what benefit patients are going to have from endocrine therapy. So although the other assays have been used to predict what an individual patient's risk of recurrence is after 5 years, they've never been shown to actually show which patients actually need more endocrine therapy. So breast cancer index is currently the only one in the breast cancer treatment guidelines that actually is used to predict the benefit of continuing endocrine therapy beyond 5 years. And that's really where it's different from the other genomic assays that we have.
To learn more about how tumor profiling tests work, check out our video linked below. There is a new registry study underway to further validate the test in 3,000 more patients. Through this study, researchers are hoping to confirm that the test effectively predicts the benefit of extended hormone therapy and to gain some insight into how the test impacts treatment decisions. New data from this trial has shown that treatment decisions changed for 40% of the patients after receiving results from the test, with the majority stopping their hormone therapy earlier than originally planned. Having more tools at our disposal, such as the breast cancer index test, can help us make data-driven decisions about treatment. These sentiments were echoed by Michelle Beck.
I love all the test results because, as I mentioned earlier, making these decisions once you have a breast cancer diagnosis is impossible. As I mentioned, I've done genetic testing, I've done the Oncotype test, and the breast cancer index test was the one that had the biggest impact on my life because I really do feel like it gave me my life back. So having these tests out there is critical so we can make those choices, because there are people who are farther along in their cancer diagnosis or journey where their decisions are like made for them because yes, you have stage 3, you have a 4-inch tumor, there are things that you need to do by standard of care. But for many people like me, where I have a lot of options, we really don't want the options. I want to be able to take have confidence in tests that are out there so I can really make the best decision for myself and the rest of my life.